All right, let's get into it. Today we're going to break down a policy that sounds almost made up. 100% tax on medicines imported into the U.S. It's a huge move designed to completely rewire the American pharmaceutical industry, and we're going to explain exactly how it's supposed to work and what it could mean for you.
So you've probably seen this headline, 100% tax on life-saving medicine. And you're thinking, wait, what? Is that for real? A tax that high sounds almost impossible, especially for something as critical as medicine. What on earth would that mean for your prescriptions?
Well, believe it or not, that 100% number is very real. But, and this is a huge but, it's not a simple flat tax that everyone pays. It's really more of a strategic threat, a powerful lever with a very specific purpose. So let's get into the why behind such a dramatic idea.
So to really wrap your head around this policy, you have to look past the price tag. Officially, this isn't primarily about healthcare or economics. The whole thing is being framed as a matter of national security.
The entire legal backbone for this thing is actually a pretty old law from back in 1962. It's called Section 232. And what it does is it gives the president the power to impose tariffs if imports are found to be a threat to national security. In this case, the argument is that our reliance on foreign-made drugs has become exactly that, a national security vulnerability.
And here's the number that really kicked this whole thing off. The investigation behind this policy found that over half, 53% of the patented drugs we rely on are actually made somewhere else. From a national security perspective, that level of dependence is a huge red flag. And this quote from the official proclamation pretty much says it all. The thinking goes something like this. If we're so dependent on other countries for essential medicines, what happens in a big global crisis? What happens if the supply chains just stop? That's the vulnerability they're trying to fix.
Okay, so this is where it gets really interesting. That 100% figure isn't really meant to be collected. Think of it more like the ultimate threat, a giant stick to push companies toward choosing a set of much better options. Let's break down how this tiered system is actually supposed to work.
This table really lays out the whole game. At the very top, you've got the 100% tariff. That's the big penalty for doing absolutely nothing. But look at the other options, the incentives. If a company says, okay, we'll build factories in the US, boom, that rate plummets all the way down to 20%. If the drugs are coming from key allies, it's even lower, 15%. And here's the grand prize. You can get a 0% rate. But to get that, you have to do two things. Build plants here and negotiate lower prices. It's a classic carrot and stick approach. And the rollout timeline is strategic too. Notice how that first deadline is for the 17 largest pharma companies? That's no accident. They want the biggest players to fall in line first and set the tone. And that 2030 date is a really big deal. It's basically telling companies, you have a 4-year window to build your US facilities at this lower 20% rate. After that, the penalty jumps right back to 100%. It really lights a fire under them.
Okay, so let's get to the question I know is on everyone's mind. What does all of this actually mean for the medicine you use and the price you pay at the pharmacy? Is your bill going to skyrocket?
Well, the policy draws a very clear line in the sand. It's aimed squarely at those expensive, patented, brand-name drugs. You know, the ones you see advertised on TV all the time. Those are the targets. But it strategically carves out a complete exemption for cheaper, generic drugs. And this number is maybe the most crucial piece of context for the average person. Over 90%. Think about that. 9 out of every 10 prescriptions filled in the US are for generics. So because they're exempt, the policy is designed so that most people won't see a direct price hike on the medications they already take every day.
And it's not just generics. There's a bunch of other important exemptions here. Biosimilars, which are kind of like generics for really complex biologic drugs, they're exempt. So are orphan drugs for rare diseases, along with veterinary medicines and other specialty products. The goal is pretty clearly to avoid disrupting care for the most vulnerable patients and other specific medical needs.
So when you zoom out, you can really see that the tariff isn't just a tax. It's a massive lever designed to achieve two very specific long-term goals, and really to fundamentally change how the pharmaceutical industry operates in America.
So it all boils down to this two-step strategy. Step 1, use the tariff threat to force onshoring and secure the domestic supply chain. Step 2, use that same powerful leverage to force companies to the negotiating table and drive down the crazy high cost of drugs in America. It's about using one problem to try and solve another. So what are we left with? You've got this incredibly ambitious policy that's trying to solve two of the biggest problems in American healthcare at once. But it also leaves us with this huge, lingering question. Is it a cure for these problems, or will it create some really risky side effects for global trade and the future of medicine itself?
And that's our explainer on the 100% drug tariff proposal. It's a complex policy with some huge potential impacts. If this helped you understand it better, do us a favor and hit that like and subscribe button. We'd love to hear your take on this in the comments. Is it a bold solution or a risky gamble?